Good morning, Mrs. Williams. I'm Dr. James Campbell. How are you today?
Well, doctor, I'm a bit nervous.
It's totally understandable. So, tell me, why are you here today?
I was recently diagnosed with breast cancer and had surgery about 3 weeks ago.
Well, tell me, in your own words, can you say a little bit more about how all this came about? How was this cancer discovered?
Well, I do a breast self-exam regularly. In September of this year, I felt a lump in my left breast. It was small and not painful. I didn't think it was something to worry about, since I had a mammogram last year and was also examined by my gynecologist around the same time. Everything appeared normal. Then, in October, I felt that the lump had increased its size. So I made an appointment with my gynecologist to confirm the presence of a mass in my left breast.
Can you tell me what happened next?
I was sent to have another mammogram and an ultrasound, and they found something in my left breast. The next day, I had a biopsy, and a couple of days later, I was told that I have breast cancer.
Now, I see that the surgeon ordered scans that showed cancer of the left breast. I also see that you had a lumpectomy and showed some positive lymph nodes.
That's right. I don't know why I have this cancer. There is no history of breast cancer in my family. I live and eat very healthy. So, doctor, tell me, since my most recent scans were good, with no evidence of cancer, why do I need further treatment?
That's a very good question, Mrs. Williams. Being that your cancer spread to your lymph nodes, the chances are very high that your cancer is spread. That is why you need treatment, to kill all potentially floating cancer cells in your body. The cancer was positive for estrogen and progesterone receptors, and that means you will need to take a pill daily once we finish with chemotherapy. Your cancer also was found to contain some protein produced by a gene called HER2, but we can discuss that in detail at another time. Good morning, Mrs. Williams.
Good morning, doctor. Boy, am I glad that I'm done with chemo and radiation therapy. However, the only thing that's bothering me is this slight numbness in my fingertips.
Well, hopefully this will improve with time. Now, Mrs. Williams, we need to talk about putting you on anti-estrogen therapies since your cancer was positive for both estrogen and progesterone receptors. Do you remember we touched upon this a few months ago?
Yes, I remember. I've heard good things about those medications.
Hello, Mrs. Williams.
Hello, doctor.
So tell me, how are you doing today? Are you having any problems at all with the letrozole?
I'm doing very well, thank you. And I'm tolerating the letrozole well.
Well, that's great news. Now, Mrs. Williams, your heart function dropped on your most recent heart test. Are you feeling any shortness of breath, fatigue, chest pain?
No, none. I'm going about my daily routine without any change.